Good morning, everyone. You're welcome to our first ever strategic intersection on climate, agriculture, and healthcare in Ghana. Please confirm with a thumbs up if you can hear me and if you can see me. Okay, great. Lovely to meet you all. Okay, so it's my pleasure to welcome you to today's session on the strategic intersection between healthcare, climate, and agriculture in Ghana. My name is Abna Adumasika, and I'm going to be your moderator for this webinar. A few housekeeping rules before we delve into the agenda for today. First one, please keep your microphones muted unless you are speaking to minimize background noise. And if you have any questions or comments, please feel free to use the chat box or the comments function, and we would address any of your comments as and when we get to the Q&A segment. If you are experiencing any technical difficulties, please notify the organizers either via the chat or through the email that you received when you did your registration. And just to add, this session is being recorded. So by participating, you are consenting to this recording and distribution of this session. And please be respectful of our speakers and fellow participants. We'll try as much as possible to keep this session in under 2 hours. Optimally, we are aiming to work between 1 hour, 30 minutes, right? So by 11:30, we should be wrapping up. And you're welcome to turn on your cameras if you want to, but it's not required. Okay, thank you. Now, before we delve into the agenda for today, I just want to add on that I'm really looking forward to an engaging session and an insightful conversation. So I'm encouraging everybody to participate. You can type in as many comments as you want. And when we get to the Q&A section, we'll open up the floor to allow participants to make their comments or ask their questions. And with that being said, allow me to call upon our host for today's session. That's in the person of Mr. Roland Bate, who is the partner for Deloitte Consulting Services here in Ghana. And he's also the lead for our government and public services industry here in Ghana. Now, Roland is a respected leader and he's known for his commitment to sustainable development, public health, and climate action. And he has played a key role in pulling together all the subject matter experts that we are going to be engaging here today. So with that being said, Roland, you're welcome.
Thank you, Aduma. Good morning, everyone, and thank you for joining today's online session. Um, it's a pleasure to welcome you all today to today's webinar on the strategic intersection of climate, agriculture, and healthcare in Ghana. Of course, as said, my name is Roland Bate. I'm the consulting partner in Ghana. Um, I am actually delighted to be part of this timely and important conversation which brings together experts and stakeholders across sectors to explore how climate change, agricultural practices, and healthcare outcomes are deeply intersected in our country, Ghana. As we're all aware, Ghana's agriculture sector is not only the backbone of our economy, but also a critical determinant of food security and livelihood for millions of people. However, the sector is increasingly vulnerable to the impact of climate change, ranging from unpredictable rainfall patterns to rising temperatures and new pest and diseases challenges. These environmental shifts do not only threaten crop yields and farmers' income, they also have direct and indirect consequences for public health, including nutrition, diseases prevalence, and access to essential services. So today's discussion basically is an opportunity to examine these complex linkages share innovative solutions from the panelists that we have, and consider how integrated strategies can help us build resilience in both our agricultural and healthcare systems. I'm looking forward to hearing from our esteemed panelists. For the panelists, we have Wesley Solomon, life science and healthcare leader at Deloitte Africa. We also have Simon Van Wyk. He's a sustainability leader at Deloitte Africa. We're also honored to have Dr. Carl Osei, who is a program manager, occupational and environmental health at the Ghana Health Service. And last but not the least, Mr. Francis Kwesi Kranche, Deputy Director, E-Agriculture and Head of IT at the Ministry of Agriculture. So clearly, we've tried to bring everybody on board to share the various perspectives. So I guess together, all of them bring together a wealth of, experience from a policy, research, and practice standpoint. So with all that said, I'd like to say thank you all for joining us for this important dialogue. I'm very confident that together we can identify actionable pathways to ensure a healthier and sustainable future for all Ghanaians. So thank you and welcome. And I hope you all have a wonderful session with us. Thank you. Back to you, Adoma.
Thank you very much, Roland. Thank you. So, to our participants, thank you once again for joining in. And we are going to do just a very quick exercise. Please type into the comment section what your expectations for today's session is, especially before we get into the panel discussion aspect. At the end of the session, we would like to confirm if your expectations for the session have been met. But in the meantime, whilst you are typing in your expectations, let me quickly introduce our panelists for today's discussion. Our first panelist for today is Simon Van Wyk. Simon is a partner and the sustainability lead here at Deloitte Africa, and he specializes in sustainability strategy, risk, and transactions. And he sits with the strategy, risk, and transactions team. He has over 25 years of experience within Africa, Europe, Middle East, Far East, and Australia. And Simon has a strong track record in building and leading sustainability and risk advisory teams. This is Simon. And Simon, if you can say hello.
Yeah, hi everyone. The only thing that I would say that's missing from that bio is that I'm already missing the jalopy that I was so much enjoying in February when I was there last. So it's fantastic to be talking all things Ghana today and looking forward to it. Thank you very much.
We are looking forward to having you again. Plate of jollof is waiting for you. Our second panelist for today is Wesley Solomon. And Wesley is a partner and the lead for our life sciences and healthcare practice here at Deloitte Africa. And Wesley has over 15 years of experience in public healthcare, strategic consulting, project management, and monitoring and evaluation. He's also an expert in data management and quality control for public health and safety institutions. Wesley, it's a pleasure to have you today.
And it's about lunchtime over here. And Simon, thank you for that because I used to travel to Ghana quite often, and we had on the way to the US, and the plane sometimes wait there for a day, and I would always volunteer to stay longer in Ghana, particularly for the jalopy, Simon. So yeah, I'm very happy and excited to be talking to everyone and learning from everyone today.
Yeah, Wesley, it's a pleasure to have you as well. Our third panelist for today is Mr. Francis Kwesi Kranche. Now, Francis is a subject matter expert with over 18 years of experience in the agricultural industry, spanning agricultural extension, economics, project management, policy development, digital agriculture, and research. Francis is the Deputy Director of Ministry of Food and Agriculture in charge of e-agriculture. He's also the head of the IT unit. Now, Francis holds a BSc in agriculture and MSc in, please do correct me if I'm wrong, Francis. Is this an MSc or MBA? Please correct week?
MBA.
MBA. Okay. An MBA in Management Information Systems and then a Master's in Public Sector Management from GIMPA. Francis, it's a pleasure to have you here today.
Thank you.
Okay. And our final panelist for today is Dr. Carl Osei. Dr. Osei is the Program Manager for Occupational and Environmental Health at the Ghana Health Service. He holds a Bachelor's in Medicine and Surgery, a Master's in Public Health from the Royal Tropical Institute in Amsterdam, and an MPhil in Applied Epidemiology with expertise in environmental epidemiology, disease surveillance, climate adaptation, and workplace health. He actively fosters partnerships to advance occupational and environmental health here in Ghana. Dr. Carl Osei is a proud member of the Ghana College of Physicians and Surgeons and the Ghana Medical Association. Dr. Osei, we are happy to have you here today.
Thank you for having me.
Okay. All right. So having introduced our panelists, I just want to do a quick check. Okay, so we don't have any expectations yet. So then I'm assuming that we are good to go. But in the meantime, participants, feel free to put in your expectations at any point in time when we can, we'll read them out. So I'll call upon Wesley to give us a brief overview for our session today before we delve into our panel discussions.
Thank you. And thank you for the opportunity. As we're having this webinar on the other side of the world in the West, it's New York Climate Week. And one of the key topics that are being discussed are Africa's role and the impacts on Africa as a continent with regards to climate resilience, etc. And we thought that it'll just be a nice way to kind of walk through to kind of what are the key factors that people are talking about Africa as a whole before we dive into Ghana. And the first thing we want to just mention that apart from Antarctica, where there's not really people living permanently other than scientists, Africa is the most vulnerable continent to climate change. And it's quite scary if you think about it, that if you think that Africa still lives off the land, our imports and our food, etc., is not as extensive as Europe or the US. And for that reason, we can start looking and thinking about if climate change impacts the way we eat, the way we consume food, it can worsen the already food insecure region of the world. So the first thing is that we really are vulnerable to climate change as a continent, and it really hits our tummies, if I may put it that way. The next thing I just want to just mention on that is that when you look at the number of extreme weather events and natural disasters, and that's measured in ways of not only the size of the event, but the impact on the country, the impact on the people, the impact on supply chain, then out of the top 10 most vulnerable countries are in Africa. And is a really, really scary stat. Just those two alone is something that we should start thinking about. The climate change, we think it's far, but in Africa, that really starts to impact us. If you think about how this moves in terms of our vulnerability and our ability to do things, GDP is a very strong indicator of a country's economy and ability to purchase aspects or develop roads or to invest in aspects. And it's estimated that about 7% of Africa's GDP is being lost every year due to climate change. So Africa is losing its GDP capabilities due to climate change. And so we ask, so what? What do we need to do to correct this? And there are many policies in place, there are many agreements, but we're estimating approximately 2.6 trillion US dollars to correct this. And on the previous slide, there was just one small part of it that if that's the amount that's required to help Africa implement a resilient state, it only receives 3% of the global financing for climate change and climate protection. On the flip side of this is the world, we live in one planet. And in this planet, Africa contributes only 4% of the global emissions. And yet we are the most vulnerable for that. So our carbon footprint is we estimate it to grow, but compared to the rest of the world, we are quite low. So we are really impacted by climate change. And I want to just bring it to the next slide is if you think about Africa, what I spoke about, it hits our bellies, hits our tummies, hits our young children, is that agriculture employs 43% of the continent's working population. 43%, just under half of the working population is in agriculture. This symbolizes the direct link between the land, the people, and the economy, which is vulnerable to what happens in the world and climate change factors. Um, I think we can just skip to the 2 slides onto this, please. Thank you. So what are we talking about climate change? There are two aspects of climate change. There's the direct impacts, and those are things such as excessive, next slide, please, excessive rainfall, droughts that affect the growing of crops, the ability to contribute to the economy and to your families. And you look at the slide also indicates the small percentage of global carbon emissions. Next slide, please. And this is what I was mentioning in terms of you have direct impacts of climate change, which is excessive rainfalls, which we can imagine what does immediately. It can cause zoonotic diseases and parasitic infections. Stagnant water is not really good for health outcomes. And then the other side, in terms of extreme heat and droughts, farmers know this all too well. They wait for the rainy season. And when the rainy season doesn't come or is delayed, it impacts the entire crop growth cycle. And the prolonged droughts, etc., also impact other factors such as the ability to produce hydroelectricity. This will be my last slide as the overview. So zooming into Ghana. If you look at Ghana, one thing you can be very proud of as a country is your very, very relatively low unemployment rate. And this is a factor of two things. The wonderful culture of the people of Ghana, where people have something called a rural drift, where during the migration seasons or the agricultural seasons, people leave the cities to go and support the farms during the harvest periods. This is such a critical component and so central to Ghana's economy because this immediately gives employment to a whole cadre of people throughout the year. Secondly, it decongests cities during that period of time, which allows cities to breathe for their sanitation and their infrastructure to cope and to be replenished. This is so important for the country in terms of the unemployment rate. And what wanted to kind of just highlight to you over here and what's been spoken at World Climate Week is let's just say that goes away or the agricultural sector cannot function as it usually does. That means that that unemployment rate skyrockets. There's more people who are food insecure, as well as the cities are no longer being decongested in period, which gives different type of communicable disease risk. So climate change is important. And if you think about Ghana's number, 21% of your GDP is contributed by the agricultural sector. Thank you. That's give an overview from there. I'll hand it back to you, Chair.
Thank you very much. Thank you, Wesley. Okay, so I see that the comment section has been enabled. So following your session, I'm seeing some expectations that have been populated. So Thelma says, my expectations for the webinar is the nexus between agriculture and health, tying that into climate issues. Sounds quite interesting, a combination that I'm waiting to see how, sorry, how this is enabled, I'm assuming, and then the experience, or rather how the abled and experienced panelists unpack all of them and more. Now, Ethel says, my expectation is to understand the topic being discussed. Thank you. And Prince says he wants to understand the impact of climate change on agricultural output and the health implications on its consumption. Okay, so these are some of the Paul also says that he's looking forward to learning how climate, agriculture, and healthcare intersect in Ghana and explore solutions to sustainable growth. So these are some of the expectations that we have. Okay, now following from this, we'll just delve right into our panel discussions. Okay, so our first question, the very first question that I have, I'll pose this to Simon. So, Simon, in what ways would you say that climate change is currently affecting agricultural practices and global food security? And what are the downstream effects on public health care?
Yeah, I would say it's been extremely disruptive. There's a couple schools of thought that climate change isn't real. Climate change isn't happening to the degree that people predicted. I mean, I'm sure many on the call are familiar with the Paris Agreement that was signed back in 2015, which pretty much says that we need to lower the global temperature of the Earth so that we can really just remain within, call it the ecosystem that we operate. That being said, what I'm seeing is because the intensity and the frequency of these weather events are just really excavating, they are getting worse and worse. The ability for countries like Ghana and many others across the world struggle to bounce back. It has a significant impact. And I mean, if I think about the kind of expectations that have been put in the chat, I would like to kind of land the point that everything is interconnected. So if we think of this as almost like a nested model, the reality is that if we don't have sufficient nourishment for our people, that's going to have a knock-on effect in terms of the health and the well-being of people, simply to operate, to function. So I do want to maybe just land a global statistic since we referenced the World Climate Week. Global agri-food systems account for just over $1.1 trillion of investment in the next 5 years. Okay. Now, that's globally. What does that mean for Africa? For Africa, we're talking an investment of 150 to $250 billion over the next 5 years. That's how important these systems are. But here's the challenge. Here's the problem. The investment that's actually being committed is only 5% of that number. So when you think of the level of impact that the continent of Africa is experiencing, and particularly West Africa, it's a bit of an alarm bell that we only have 5% investment. So I think there's a focus point there where we really need to prioritize how we prepare for climate change, and of course, how we prepare the specific industries of agriculture and the healthcare sector.
Okay, okay. Thank you very much, Simon. Thank you. Now, I'm switching this a little bit, and then we're going to look at this from the health perspective. So, Dr. Osei,
Hello.
yes. So, to add on to what Simon says, I'm curious to know when we look at the public health sector, what are some of the effects that you can speak to as it relates to climate change?
Okay, so we know that extreme weather events such as floods, dry spells, droughts, intense heat, and also strong winds, windstorms, um, destroy crop production and also affects livestock and therefore affect food security. Now, food security has to do with the intake of food in adequate quantity as well as quality. So we know that when there's inadequate intake in terms of quality or quantity, we get malnutrition. And then not only malnutrition, but also other health outcomes like anemia, poor reproductive health outcomes like low birth weight and preterm births, miscarriages are all outcomes. Also, you have usually those in the rural communities whose livelihood depend on farming. the women and children that are going to be more likely to be affected by some of these outcomes. And also we know that when these extreme weather conditions occur, it affects the entire economy of these communities. And in health, we talk about determinants of health. It's not only the presence of pathogens, etc., that causes disease, but even the fact that the economy collapses, people are not able to afford the basic necessities of life. They cannot even access healthcare and all that. It has adverse effects on their health. Also, we know that the risk of water contamination would increase due to water scarcity as a result of climate change, and all this would increase the risk of foodborne diseases, waterborne diseases, and also the quality of the drinking water. And as I said, this affects mostly those engaged in the farming areas. Also, poor food storage conditions, whereby the foods become moldy, have mycotoxins, and so on and so forth, can also expose the human population. So, yes, in diverse ways, we see pathways between climate change through agriculture impacting public health.
Okay. So in relation to this, would you say that there's some specific opportunities that exist for collaboration between the healthcare sector and, agriculture if we are seeking to build climate resilience?
Yes, I think we have opportunities at all levels: national, regional, districts, community level. Health sector has a large workforce, and then we also have intersectoral committees, usually at all these levels. And I think um, in our community engagement programs, for instance, we can also collaborate closely with agri officers or professionals um, in rendering out for example, our growth monitoring programs. We do child growth monitoring, and then also nutrition programs. There, I see opportunities there for a lot of collaboration in syncing our messaging to those in the community. So we are talking about how they can eat balanced diet, etc. And then the farming and the agri community is also going to help in empowering them with knowledge on how to grow crops to ensure that they are able to achieve this. I think we can do that in terms of planning, collaborate in terms of planning also at the district level. We have a lot of committees where we, health sector officers and agri officers are together on these committees. And national, we also have the coordinating mechanism being led by the EPA. We in the health sector, the ministry has even decided before the end of the year to set up a high-level steering committee, and agri could be part of it, so that we can all be aware of what each sector is doing, look for opportunities whereby we can partner and know how to synergize our efforts to be more effective in implementing our programs. So yes, there are a lot of opportunities. Yeah.
Okay. Okay. All right. Then piggybacking on the issue of collaboration between the sectors, Simon, Wesley, and subsequently Francis, in that order, how can we leverage technology and innovation in agriculture specifically if we are seeking to help mitigate health risks that are associated with climate vulnerability or variability?
Thanks. So a couple technologies come to mind. Solar thermal energy is really, I almost want to say, the new kid on the block. It's absolutely suited for agriculture, but also healthcare systems. What solar thermal technology entails is basically, if you could imagine solar panels are in theory only effective when the sun shines. Solar thermal technology actually creates a bit of a storage system within the panels. There's a specific kind of salt aggregate that they use, but that actually retains the energy that you get from the sun. And the benefit of that is that you actually have solar energy 24 hours a day. And what's lovely about this technology is that you can, it's super easy to install, but it's perfect to run things like water pumps. And the same would apply again on the health sector in terms of running things like generators. So from that perspective, I would also say, in particular to agriculture, the water reticulation systems that are used to water the crops. There's actually turbines that you can install in the pipe network. So as the water flows through, it turns a turbine that generates electricity. And we know that for any successful farm and agricultural processing, you need water and energy. Those are the two kind of fundamental aspects that you need to get. So there's definitely a part for technology to play. What I would also add, though, is that there's a lot of smart agricultural practices that are available, but people just don't know what those tools and techniques are. So I think there's definitely a part around training and awareness so that we can influence farming culture. I think we need to appreciate that farming as an industry is a generational industry. You know, it's passed from one family to the next. And with that come the practices that have been taught. The problem is that the environment that we live in today is certainly not the same as it was 20, 30, 40, 50 years ago. So there's definitely an evolution in terms of the techniques, because you just can't rely on what happened, over X decades versus what we need, not only now, but also how we prepare the agricultural sector for the future. So, yeah, I think those are probably two important aspects. There's also very well-known aspects, like instead of spraying crops, use drip irrigation. That's been around for a number of decades. But yeah, I would definitely say a combination of technology and cultural change so that we can kind of prepare ourselves for the environment that we're entering into. Yeah, I would pause there. Thanks.
Yeah, thank you. And then Wesley, would you like to add on to that?
Well, I firstly want to just applaud Dr. Say with the way he structured the way the information is being used in terms of proper think tanks and proper governance. That is critical. And I'm going to layer the technology question on top of that. When the internet became a real thing, Europe had landlines, had hard cables, etc., and Africa was lagging behind. And everyone costed, if everyone in Africa had access to the internet, what would it cost? And everyone costed the fact of laying down these cables and stuff for terrestrial internet. And Africa had a different plan. We used our mobile phones to the nth degree and basically have the largest the mobile phone penetration in Africa now is that if you take the population of Africa, they have access to two phones at least. So the penetration is even more positive than that. What's come with that, with the innovation, is we were able to leapfrog our stepping into the internet and the data age because we thought differently as Africa, our banking, our processes. So coming back to technology in terms of farming and infrastructure, one of the things that we should be leveraging is this tool of our digital technology, such as Simon mentioned, farming is a generational practice with knowledge being passed down. But if a crop has got a certain looking funny leaf or looks a bit different, taking a picture and sending it to someone who can help you assess and come with an action plan, as Dr. Osei was saying, these think tanks, early warning systems, that is leveraging the existing technologies out there. We can speak about drones and smart crops and digital interfaces telling you what to do, but ultimately it comes down to can you detect something early? And can you get help and advice on what to do next? And I think that's the leverage of that the technology should move towards innovation.
Okay. Thank you very much, Wesley. Okay, so Francis, okay, from your perspective or from your role as the Deputy Director in charge of e-agriculture, what would be your take on this? And also, in addition to that, what are some policy interventions that we would require to better align, climate, agriculture, and then healthcare objectives in Ghana?
Thank you. As the earlier presenters, speakers indicated, that the country, especially the Ministry of Food and Agriculture, is leveraging IT to execute a number of interventions within the agriculture ecosystem. For instance, when you come into the agriculture ecosystem, we have drones that some farmers are using to either spray their crops and also taking some uh, field measurements and also documentaries on the field. And additionally, we are using the smartphones for a number of things. For instance, when you look at the ratio between agro-extension agents to farmers, it's quite alarming. But because of these emergence of telephony, some of the interventions, the AEs do not need to go to the farmer. They can use the phone to interact and also share some innovative ideas within the agriculture sector. So these are some of the interventions. And within the ministry, we are trying to build our data center and also a NOC where we can use it to monitor and coordinate some of these interventions. We've built we've built a system called Ghana Agriculture and Agribusiness Platform, where we have a number of models. But for the purpose of this discussion, we have a climate model where we can predict some of these weather and also forecast some early warnings for farmers to be prepared for droughts and also flood intervention. Yeah, so these are some of the interventions that we are taking in the space of IT. But when it comes to policy interventions, we need policies that deliberately integrate these three areas. First, nutrition targets should be mainstream into agricultural policy. For instance, Feed Ghana should be tied to reducing malnutrition. Second, we need to expand climate finance for programs that deliver both agricultural productivity and health benefits, such as irrigation and clean water systems. Third, create joint planning mechanisms. That's where interministerial task force bring agriculture, health, and environment to the same table. And finally, platform like the gap that I spoke about should be institutionalized to provide data, the data that government and partners need for evidence-based policy. Thank you.
Okay. Thank you very much, Francis. I'm very happy that you actually brought us to evidence-based policy making. So, in relation to evidence-based policy making, I'd like to find out from Wesley, how can research institutions and universities contribute to evidence-based policy making within the climate, health care, and agricultural space?
Thank you for that very easy question. Um, in terms of just piggybacking on Francis's answer over there into an evidence-based aspect, is that universities are specialists at really unpacking the biases we might have, the confounders, that and started taking to say what are we seeing from a real world view, and what are the factors there that actually can quantify or substantiate what we are seeing. So, programs that are successful, why are they successful? What are the economic impacts? What is the forecasting of this going forward? Universities are the best place to do this, to say, let's put our brain power, let's create PhDs in climate resilience. Let's create, I think Simon has a different word for, other than resilience, he'll probably say it later on. But moving towards the universities having, let's create a apart from the obvious assessment and monitoring and evaluation academic publications or success stories or factors influencing it, but let's create a whole cadre of activists in universities that climate change becomes mainstreamed in every single discipline over there. If you're studying government and public services, let you do modules on agriculture, climate change, and the impact of climate change. If you're studying law, let there be aspects of climate change and understanding what the policies mean, etc. So I think there's a twofold factors of what universities can do. And the last part is cross-sectoral collaboration across the globe.
Chair.
The universities have a seat at the table at items such as New York Climate Week or at Davos, etc. When we start speaking about these aspects, the academic institutions have got that seat and that rigor that they can bring to the table.
Okay, okay. Wesley, thank you very much. So Wesley, I'm sticking with you for another few minutes. But so in relation to, evidence-based policy making, obviously, in order for that to happen, it's important for there to be data that's available, right? In order for us to be able to, develop these policies. So in Ghana, are there any key data gaps, especially at the intersection between these three areas? That's climate, agriculture, and then healthcare in Ghana. And if there are, how can we address some of these?
My colleagues from Ghana would probably be better placed to give them more details for it. But what I can look at the different key databases, either World Bank, the WHO, the different surveillance mechanisms that we have to report for things like CDC, there are no real massive gaps in the Ghana data as you currently have it. Your IT systems are quite strong. You have also the cadence of it being populated is very good. Where I think the gaps come in is how do you bring this together and look at it in a real strategic way. And that can require, as Dr. Say was saying earlier on, these think tanks, these governance forums, of really being intentional. For example, there's a current analysis that we're doing not only for Ghana but for a whole region for a climate change project. And one of the assumptions that we put in place is, so what does a 1 degree in temperature increase mean on average for in terms of health? And when looking at it, and the same here, not much. So in 2024, if it's a 1 year increase in temperature, we're not going to see much difference. But if you look at a seasonal cycle of 2 years or 3 years later, you start seeing that parasitic diseases or zoonotic diseases have a directly proportional increase in the incidence rates that were going forward. So we have the incidence rates for these zoonotic diseases. We report it. We have the climate data. We even have the data on agriculture. But putting it together in a framework to start saying, making it meaningful and actionable before we head to crises and not looking retrospective is the factor that I'm quite excited for Ghana to put together.
Okay, thank you. All right, so Simon has his hand up. So Simon.
Yeah, I'd like to just piggyback off that because Wesley and I are doing a very unique project. And it's one that no one on the line here, I think, would even dream to think it's possible. And it's actually got to do with polar tipping points. And you might say, well, how does polar tipping points affect Ghana or Africa? And it really is profound. So, and I'm raising this point because we were talking about gaps in data. It's not that there's gaps in data. What we are questioning is And I'm going to use an agricultural analogy for any of those that know the grape farming industry. At the end of every row of a grape farm, call it row, they typically plant roses. And the reason they plant the roses is that if the petals start to fall off, that's an early indicator that the rest of that farm area is going to be under stress and you need to react kind of proactively. So the study that we are doing now is the effects of the polar tipping points on health and healthcare systems. We've done, I would say, similar for the agricultural sector across Africa, but why this is important is that 6 of the 9 worst tipping points are looking to happen at the poles, North and South Pole first. So our rose petals. Now, when we look at what that means in terms of impact to Africa and specifically West Africa when it comes to crops like cacao, yams, maize, cassava, rice for the jollofi we love, and oil palm. These are all major crops that Ghana is well known for. And the reality is that I think this is where our research comes in, is that if we can provide early indicators and actually influence the likes of the IPCC's data sets that we are so reliant on, we'll be in a better place to be even more prepared for the future, which comes back to this idea that we need to become both adapt and resilient. So I just wanted to add that to Wesley's point. Thanks.
Okay. Thank you very much, Simon. Now, I want to hear from each and every one of our panelists. I'll start with our local experts and then our Deloitte experts to provide an outside-in perspective. So in relation to climate adaptation measures, right, starting with Francis, what has proven to be most effective in supporting both farmers and the rural healthcare systems here in Ghana?
Yes, some of the most effective measures are those that secure both livelihoods and well-being. For example, irrigation and dams like Walugu ensure year-round farming, which reduces hunger seasons and improve nutrition. Agroforestry and drought-tolerant seeds are helping farmers maintain yields despite erratic weather, whilst also protecting the environment. And digital solutions like GAPS climate model give early warning to farmers and rural health system so they can prepare for droughts, flood, and related health outbreak. In short, adaptation works best when it safeguards both food and health. Yes, thank you.
Okay, thank you. Dr. Say.
Hello.
Yes, hello.
Yes. I think I agree with all that the previous panelist mentioned. And just to repeat what I said, I think we need stronger collaboration amongst ourselves, intersectoral collaboration, to be able to take advantage of the advantages we have, and also the other side has. As other panelists mentioned, there's a lot we can do. For example, in the way of developing early warning systems. You know that health outcomes are usually the outcomes of different exposures in the environment and climate change and agri practices, etc., all affecting these outcomes. I believe that we can depend on the agri sector to be able to give us the information we also need to be able to predict even more accurately some of these outcomes um, before they happen. And then I think vice versa also, we can also provide the agri sector with some of the health data they need to understand the correlation or the relationships between what they do and the diseases outcomes. So I think, yes, there's more room for us to strengthen collaboration at all levels. And that way, I'm sure whatever ideas we have on both sides, we'll be able to implement them more effectively. Thank you.
Okay. All right. Thank you very much. Now, Wesley.
Yes, ma'am. I don't know how to add to these comments.
What
It's
would
just
be your
encourage.
outside in perspective
Oh,
on?
yeah. It's just that a country that's willing to invest in collaborative approaches to it. And maybe an example, we were chatting earlier on with some of the panelists, and the examples of during a massive threat like COVID-19 was to countries. No one expected Africa to respond as it did. Nobody did. They said once it hit Africa, it's going to be Armageddon. And yet it was bad. And we lost loved ones. And our countries are still recovering. But it wasn't as bad as everyone predicted. And we have to ask why. And it was because the biggest innovation and technology we have is our people. And we came together in these strategic labs of these rooms. People locked each other, kept their social distancing, but locked each other in these rooms and said, we will figure this out with an urgency and an intent that is second to none. We'll get people like external facilitators in and subject matter experts, and it's say for your context, this is what needs to be done. And we put everyone who needs to be in the room and we get it done. So from outside perspective is we can have the best documents, the best policies. We can even have the funding available to do what needs to happen. But we don't have these drives and champions and really leverage the people's expertise, then we'll be having this webinar 2, 3 years in a row with no move forward on it.
Okay. Thank you very much. Thank you. Simon, would you like to add anything to that?
Yeah, I'm typing away here at the various questions. But yeah, I wanted to maybe just add something here around the fact that we are disproportionately impacted by the effects of climate change. And as I might have mentioned earlier, there's really two paths that you can follow. The one is one of we must reduce our emissions. But the kind of backlash of that is, well, why should we do that? I mean, let's take Ghana as an excellent example. There's rich natural gas resources. I mean, there's so many FPSOs off the coastline of Ghana, and you've got to ask yourself that question about why should Ghana be impacted negatively when the contribution to emissions is with many other first world countries around the world. Well, the reality is that we can't pick our geography. We are where we are. And from that perspective, we therefore need to look at, well, if we reduce emissions, is that a net positive to our business? And in many instances, the technologies are there, and there is significant opportunity for upside, so return on investment. If I take, for example, the hydrogen corridors that are being considered across Africa, a lot of those hydrogen pipelines traverse Ghana. They might not originate in Ghana, but they traverse Ghana. And so there's an upside there. There's a potential upside there. But the other part of the equation, of course, is that climate change is happening. It's happening in front of our eyes. So many times, if you heard stories from your parents or grandparents in the past, they would tell you how the weather systems would be, and that if they're still alive and with us today, they would say this is vastly different to how they grew up. That's one perspective. The other perspective is in our current generation. So in the time that all of us on this line have been on Earth, we've witnessed it ourselves, which is already a testament to how quick these things are happening. So if we don't brace for adaptation and resilience, we're going to be naive. We need to protect ourselves. So I totally agree, 100% hand on heart as a fellow African, that we are being impacted as a continent, but we can't run away from that reality either. So let's face it head on. Let's look at how we can augment the way that we operate and ensure a return on investment, some upside. And then prepare ourselves for the future. It's not just about us either. We need to think about our future generations, those that are on the line that have kids. I have 2 kids. And I know, Wesley, we've spoken many a time how passionate you are about this. We need to think not only for today, but for future generations. That's the whole point of sustainable development. Thanks.
Thank you very much. Okay, so we'll take 3 actually, more questions before I open the floor for the participants to share their comments, opinions, and questions. Okay, so the next question I'm going to ask, I'll direct this towards Dr. Osei. So how can public and private investment be mobilized to support cross-sectoral initiatives in this intersection?
Yes, thank you for your question. Yes, so we look at this broadly, even beyond agriculture, looking at health sector adaptation as a whole, because the exposures in the environment are many, and the sectors that have to control these are many. Agriculture is only one of them. And then we see that we need, hitherto climate change and health has not received the attention that it deserves. We develop medium-term plans from time to time in the health sector, 4-year medium-term plans. Currently, our medium-term plans doesn't contain anything on climate change. And fortunately, now this is changing. The next medium-term plan, starting from 2026 to 2029, we've been able to capture climate change and health activities in it. And this is important because it will ensure that in future budget allocations, climate change will receive some governmental allocations. And then also, fortunately for us, we have placed the climate change desk at the Ministry of Health. At first, the Ministry of Health was not so active in it, and it's now the desk is in the planning and budget office. So as far as availability of funds is concerned, and also appear in our budgets, climate change reflecting our budgets are concerned, we know it is very likely, or yes, we are almost sure that regularly climate change will be given the allocations and receiving the allocations it needs from government to improve implementation of our planned programs and activities. So from the governmental side, we have adopted the strategy of also setting up the high-level steering committee I mentioned. That will also serve as an advocacy group, because we have all the chief director and the minister who may be represented, and so on. And so even within the health system, there's the need to strengthen intra-agency kind of collaboration, which has been weak, so that all the various departments, even with the health sector, we're able to work together more effectively to plan how to address some of these planned activities um, in our national adaptation plan for climate change. For the private sector, it's an ongoing process, but you need to ensure that we rope in the private sector. For us, we work closely with the World Bank, the WHO, other NGOs like FCDO and others. There's the need to be able to um, involve them in activities. If you don't collaborate, you don't invite them to meetings when you are implementing programs, you lose that spirit of camaraderie between the group, and then it doesn't augur well for collaboration. Also, in the area of the GCF readiness funds, we know that we have the NDA, the National Designated Authority at the Ministry of Finance, which oversees the disbursement of such funds. Now we realize that the health sector has not been a member of the committee that oversees the disbursement of these funds. So with advocacy, now we have been given the green light to nominate a member to be part of this committee. I believe that is going to go a long way to make sure that our proposals are more successful in securing funding from some of these international financing mechanisms for climate change. So I think, with all these initiatives, we should be able to, in future, mobilize funds better from both the government as well as international and private organizations. Thank you.
Thank you. Thank you. Thank you very much, Dr. Osei. Now, Simon and Wesley, would you like to add on to this? I'm actually curious to know. So we've talked about the initiatives, but we've talked about the fact that we can get funding from government, private sector, and then the donor agencies. But if we are speaking to specifics, how really can we, raise funds to support these initiatives?
Yeah, I'll definitely take that on. So just again, a couple stats. I know we've spoken a lot about agriculture in today's webinar, so I just want to kind of pivot a little bit to the health side. As you obviously know, Ghana has a population of 34 million people. But when you look at the number of available hospital beds per capita, okay, so that means how many hospital beds are available per 1,000 people in Ghana. I would like to have asked in the comments if you could pop some percentages in, but for the purposes of our call here quick, I'll give you the stat. It's 0.7%. Think about that. Okay, if 1 out of every 1,000 people in Ghana need a hospital bed and you have a 0.7% chance of getting a bed, that is alarming. So how do we overcome such a risk? And the way that I've seen, and I just want to share a tangible example because I had the absolute privilege of joining a government contingent in Luxor, Egypt, 2 years ago. We went to a hospital called the Shifa Al Orman Cancer Unit Hospital. So maybe check that out. It's really a great success story. Now, the question was, how would you fund a new cancer unit? Well, the way that they funded it is that they went to the private sector and got sponsorship for wards and for equipment. So what you would do just as an experience walking through the cancer unit is you would see plaques up at every ward, and you would see that Anglo American or Total Energies or Siemens or Philips or whatever have either donated the equipment or they've donated the beds, all the different medical devices and things that one would require. I was fascinated by this model because it was an opportunity for the private sector to give something back to the community, and it really works. Now, I want to tie something back together quickly because we are kind of in the conclusory section of the webinar. What is the link between climate, agriculture, and health? Well, when you look at the effects of climate across Ghana and specifically in terms of North Ghana, as an example, there's a high risk of wildfires. Now, when you go and overlay the available hospital facilities in North Ghana versus South Ghana, there's a distinct disadvantage. Okay, so put yourself in that situation to try and grapple not only with the sustainability of your agriculture and the effects of wildfires, which displace people, creates vulnerable communities. With that, you're almost creating an ecosystem that supports potentially, and it's not my area of expertise, I'll leave this to Wesley and others, is that I could see a environment emerging that could bring about potential diseases. We need to solve the hospital situation. If there's not appropriate infrastructure for people to the tune of 0.7% per 1,000 people, I would say private sector has a significant opportunity to make an impact in Ghana, especially in vulnerable areas. I'll pause there. Thanks.
Thank you very much, Simon. Now, my last question
If I
actually
may, if I
comes.
may chip in to
Yes,
just
please.
add to what Simon said, I think it's important. Yes, that's also yes, we need the private sector, but in terms of the statistics, I think it's important to usually have a target, because literally per 1,000 beds, there are other issues. Not everybody will need a bed at the same time, and also we have other indicators like bed occupancy rates, which may be more accurate in showing the actual demand for beds. And with this statistics, I think we should also be careful because we should have targets, like as I was saying. What is the target that we want to get to as a country, given the fact that we will not be able to provide reach anything close to 1,000 per 1,000, because people are not all hospitalized at the same time. So I think we must try and maybe look at how to present the data also so that it really captures the problem quite accurately on the ground. And I agree with the fact that we must target those areas that are vulnerable. These are some of the statistics that we can use to identify where we have vulnerabilities so that we can see how we can address these vulnerabilities together with the private sector. Thank you.
Thank you very much, Dr. Osei. So before we start addressing the questions in the comments section, I have just one more question that I would direct to Simon. So Simon, well, one question to Simon and then the last one to Wesley. So Simon, in terms of the intersection between climate, agriculture, and then healthcare, what are the biggest risks and opportunities that you foresee for Ghana? And then how can Ghana position itself to be a leader in integrated climate, agriculture, and healthcare solutions, specifically in West Africa?
Yeah, so I'm going to conclude by saying we definitely need to embrace an ecosystem view in terms of just how Ghana operates across the food and agricultural sector and how that intersects with the health sector. So the way I basically see it is all these systems are fully integrated. And just to bring us right back to the start, Wesley shared a stat that 43% of jobs are created through agriculture. But here's the interesting thing, and this is why I talk of it as an ecosystem. Agriculture accounts for 90% of deforestation. So just think about that from an environmental perspective, is that we have this dichotomy where you're trying to support a nation and you're trying to ensure that they remain healthy at the same time, but all the while you've got a confined environment within which to operate. And that very environment that we are relying on is being impacted by climate change. Again, coming back to the floods, the droughts, the wildfires, the list goes on. So the way that I kind of foresee things going forward is one needs to be very clear on the value chains across the health sector and how that transposes with the agricultural sector and then vice versa. If we can get that balance right, I think Ghana is going to be able to demonstrate a significant leadership case study for the continent of Africa. And let's also be clear, Africa is the last third world continent, okay, in the world. So from a perspective, I always say there's three areas that people focus on in Africa. A little bit biased, I am based in South Africa, so people look to the south, they look to the west, and they look to the east. So we talk Ghana, we talk Nigeria on the west. On the east, we talk Kenya, Tanzania, maybe a little bit of Uganda, Ethiopia in there. And then, of course, south is primarily South Africa, Botswana, Namibia. So I think there's a huge opportunity for Ghana to demonstrate how they get that ecosystem right and share it with the world. That's certainly the kind of story that we're trying to project at forums like New York Climate Week, which again just ties back to what Wesley shared earlier. Thanks.
Okay, thank you very much, Simon. Okay, so to tie into what Simon just said, Wesley, how can we develop integrated strategies that would address climate change, agricultural productivity, as well as public health outcomes simultaneously? And once you're done, I would like to also hear from Dr. Osei and then Francis.
Firstly, Simon and we work for a wonderful organization called Deloitte, and we are honored that you are bestowing citizenship for us from Ghana to both Simon and I. Thank you, Roland, for organizing that, because we are very invested in Ghana for the leadership capabilities that are there, for the ability as a strategic hub in the West, as Simon said. So going back to your question in terms of how can we invest in these integrated strategies, I wanted to actually say there's something about a perspective change that needs to happen. At Deloitte, we have a motto to make an impact that matters and purpose beyond profit. One of the things that I think that Simon was alluding to is that climate resilience or strategies to improve less emissions, such as deforestation techniques, strategies to improve lessening your impact, your footprint on harming the earth, can actually be very profitable. And that takes back to what Francis was saying earlier on about if it's profitable, you can feed more families. If you feed more families, you can make better choices. If families are more secure, they can send their kids for better educations. So there is an ecosystem approach. And I don't think that we should be thinking about climate change as something that we need to do to save the planet. In actual fact, if we do this right, we can actually lift the quality of life of everyone on the continent through a purpose-driven approach. So profits is not a nasty word that we have to be scared of, such as if Ghana is able to leverage the natural gas in a way that is minimizing impact on environment and improving the economy so that they can stop deforestation at the rate or plant more things. The net effect is what we need to be looking at as a holistic community. And that is something that I would just wanted to put forward that it's fantastic working for a company like Deloitte who pushes those boundaries and says, is this purposeful? Should we be doing this? What is the meaning? How are we improving the environment, etc.? And how are those funds that have been made plowed back to improve the ecosystem further?
Okay. Thank you very much. Thank you. That's insightful. Okay, so Dr. Say,
Hello, Abuna. I would like you to please repeat the question.
yes.
I
So
didn't.
okay, so I was asking, and then Wesley was speaking to the fact that we are trying to identify how Ghana can develop integrated strategies that we can leverage to address climate change, agricultural productivity, and then public healthcare outcomes, all at the same time. Yeah.
Okay. So, like I've mentioned before, the health sector has an advantage of having a network that reaches very far to the community level, where we see that we can integrate, um, especially our child nutrition outreach services with ongoing projects at the community level from the agri sector. We realize that there can be joint planning and implementation at this level, at the community level, whereby as we even carry out outreach services, we can have the benefits of collaborating with um, our agri officers or professionals at that level, so that it can maximize the impact of whatever we are doing as far as preventing malnutrition. I know there have been some examples where um, agri officers have been able to even support in teaching how to do some food processing that will help the locals to even preserve the quality of some of the vegetables that they have to usually are in short supply during the drought periods, and thereby avoid or reduce micronutrient deficiencies in these children, and then also help them to plant the right kinds of vegetables and fruits, so that it's not like they are only eating or producing carbohydrates, which would mean that even though you educate them to have a balanced diet, in terms of capacity to do so, it will be limited. I think in the area of integrated, maybe data sharing, I think is also another area that I think we need to collaborate. But it's always been a problem. This issue about health and environment platform for data sharing has always been there, but usually getting support um, to be able to develop an IT platform, a dashboard by which we can share that minimum quantity of data that um, we will need from each sector to be able to enable us to carry out more detailed and more effective analysis that can support, as we said before, evidence-based decision making in each sector. So I think in terms of data sharing, I also see an opportunity to develop that kind of integrated strategy. And then also when it comes to health education or education at all levels, I think we should all try and as much as possible not forget the other sector, but work in harmony, um, so that our messaging is more effective, and then we can also learn from each other. So I
Right.
think that's what I'll say. Thank you.
Thank you very much, Dr. Then we would hear from Francis, and then we would open the floor for questions.
Thank you. Abna, I think Doctor has said it all. Yeah, I think Ghana needs to connect climate, agriculture, and health in a single framework rather than treating them as separate issues. For instance, integrated strategy could include scaling up climate smart agriculture, like I indicated in previous questions, that drought resistant crops and irrigation, but also linking that directly to nutrition and food security goals. And I indicated that the ministry has a platform where we have information or data on farm mapping and also weather predictions. And we can align some of these things with agricultural productivity and health planning. And as Doc indicated, the most important thing is ministry must collaborate. The ministries, for instance, the agriculture, health, and environment. So our policies reinforce each other, not work in silos. This is what I can share. Thank you.
Thank you very much. Thank you to all of our panelists, Simon, Wesley, Dr. Say, Francis, Cranche. Thank you